Hello, everyone. Glad to be here. My name is Jackie Boers. I'm a project director at CounterTools, as Rebecca mentioned. We at CounterTools are a nonprofit organization started in 2012 and are based out of North Carolina. And we provide trainings, webinars. We even provide software tools that we've created to really understand and track what's happening in local communities. We support advocacy efforts, create communication materials, and all of that. And our expertise is on the point of sale, so that's going to be my focus today, and I'm going to talk to you all about why it matters and what should be done. And, when thinking about the point of sale, let's just get into it, right? The point of sale is where tobacco enters communities. It is one of the primary places people get access to these products. These are your local stores, these are your convenience stores, your gas stations, grocery stores, vape shop, tobacco shops, liquor stores. Every store you can think of is probably counted under that point of sale category. And like I said, this is where people are getting these products, and these products are not staying at the point of sale. They're getting in the hands of youth, right? Some stores sell to underage youth. There is that piece. It's getting in the hands of people that are put at risk, that are already vulnerable or already experiencing other things. It's getting into the hands of those that are older. It is getting into the hands, these products, of everyone, right? And the point of sale is one of the places where that is happening. And I want to really just talk about the point of sale as far as the tobacco industry's influence in this space also. As Rebecca mentioned, the industry is spending millions in South Carolina, but billions across the country to market and sell their products at the point of sale. So they're sending their products, they're sending their marketing materials to these stores to sell, and a lot of times they have contracts with these stores that say, okay, you need to put this marketing material here, you need to put this product here, you need to sell this specific product, and they're very targeted with it because they will do these certain practices or require these certain things in certain neighborhoods, right? And who are in those neighborhoods. So it's very intentional what is happening at the point of sale. And I'm going to talk about what we promote at CounterTools and what I personally think, my thoughts on everything, and also what just are the best practices when we're talking about the point of sale. And I want to put things in context of a acronym. We like using acronyms in public health, right? DPI, so data, policy, and other interventions and impacts. So really understanding those three aspects when we're talking about the point of sale. And I'm going to put these in the context of South Carolina too, and what is best practice with the state and in the point of sale work. First, let's start with data, right? I think one of the key ways to get local support is through data, showing people the evidence about what is happening in their communities. I know before I started at CounterTools, I would just walk into a store and just go about my business. But then, working at CounterTools, I have that heightened awareness. So literally every time I go into a store now, I'm like just hyper aware. I'm like, oh, where's the tobacco at? Or where's the tobacco product? Like it kind of makes not going to stores fun because I just like scrunch up my nose and get mad that I'm seeing all of these things. But as you can see, I'm one person and I'm getting mad, right? If you think about other people and bringing up that awareness and increasing that awareness, we all can get mad and do something about it, right? So I think data is that evidence that is absolutely needed, and data specifically on the point of sale, what's being marketed and sold, is that data that's needed. And when we're talking about that, involving people in the data collection efforts, I think, is one of the strongest ways to get that support, to help people understand what is happening, involving the people that are most effective. So gathering, I've heard stories of legislatures who don't know what the problem is. We might talk about it, but until they go into a store, their decision might change at the end of the day. Involving youth, bringing youth into the store, involving community members, regular old folks. You want to come along, if you know someone at church, like I'm doing something, come along with me. So involving as many people in the actual data collection process, I think will get people more on board than if you just talk to them. Oh, here's what's happening. No, involve them, and then they'll get more aware. So I think that's one of the key points when we're talking about data. And then when we're also talking about data and getting that support is using different data for different audiences, right? Using different messaging strategies for different audiences. I think sometimes people can get in a rut and they use the same, messages and say the same things. And, we wonder why some people are not really understanding the message. Well, I think it's important to really use data and messaging in a very strategic way, and knowing the audiences that you're working towards and working with to make that change. So that's another key point, is really using the data and messaging in an effective way, and using it and matching it to the audiences that you are impacting. So definitely important, that data piece, and understanding what's happening and what's being marketed and sold. And we actually, as Rebecca mentioned, there are some efforts going on right now at the local level in collecting that assessment data. And it's also important to collect that data about what is happening on a continual basis, right? We know there are so many new products out in the market, right? We actually have done this store assessment process with the state. We've partnered at Counter Tools and provided a way for the state to collect the data. We've been doing this for years, right? We've tried to cover the whole state as far as doing those store assessments. But things have changed, right? Just in the last couple of years, we have products like synthetic nicotine. With synthetic nicotine, we have nicotine pouches. We have new e-cigarette products on the market. So really tracking that data is important, and doing those store assessments is important. And we have some examples that are literally happening right now of doing that data collection. So I say that to say that if you're not involved in the data collection and you want to be, or it's very important to be, we do have that platform in place to do those assessment efforts, and it is funded by Smokefree SC and DHEC to do data. So I think data is really important. People will not say yes to something they do not understand, and data gives you that backing. And also, when we're talking about data and using data, going back to this idea of audiences, what data will best resonate, right? We can talk about the numbers and stats, the assessment data, what's being marketed and sold, but we can also use visuals, pictures, of what's happening can be very influential. So that might be another way. Someone might not want to see all the numbers, but they'll definitely understand through some pictures. Stories are data. So as much as we can get those local community stories is important. And there's many other different data sources, but I think that those are definitely key. Having that quantitative data, what's happening, having those stories, and all of that. And then we go to the policy, right? The nitty-gritty of what can be done. And it's been hinted and talked about a few times here, but I'm just going to go over some top policies, some best practices when it comes to policy dealing with the point of sale. We can talk about tobacco retailer licensing, and that's been mentioned a few times. Tobacco retailer licensing is a very important policy at the local level. It can be done at the state level for sure, but again, this idea of bringing power and keeping power and empowering people at the local level, local tobacco retailer licensing is the way to do that. And so I think that's one of the key policy areas to work towards. We have a county, York County, that they are on the path to working towards a TRL bill in the county, and this can be replicated in any other counties. And with TRL, that means basically, making retailers have a license to sell tobacco products. And with that is you can cap the number of licenses that can be issued by certain factors, right? If you want to cap it in a certain area, those areas that are most affected by these products, you can cap a certain amount of retailers in those areas. You can determine how many feet retailers can be from schools, right? Things like that you can include in the tobacco retailer licensing policy. So you're not only tracking what retailers there are and what they're selling, but you're also preventing those impacts in certain areas by the policy. So I definitely think tobacco retailer licensing is one of the top recommendations, especially at the local level. And making sure when we're doing tobacco retailer licensing, also understanding that can be an umbrella policy. So you can actually include a bunch of other policies under it. We call them plugins. So you can do policies, as was talked about. The industry is spending a majority of their money on price promotions and discounts. That is their top kind of piece of where they're spending the money, is price promotions and discounts. So you can add a policy, add a plugin that restricts price promotions and discounting. You can add a bunch of other plugins that restrict flavored products, right? That has been talked about, menthol and flavors. You can add a plugin for that in the TRO policy to restrict those products. You can do buffer zoning of near schools and all of that. So there are many plugins that go under tobacco retailer licensing that make it much stronger. Again, remember TRL. There's also a couple other policies that I'll mention. Flavored, whether it's doing it through TRL or just doing it general. As Del Monte spoke to, flavored restrictions work. The data shows that they do work. And so I think flavored restrictions, including menthol, because that has been left out of a lot of flavor restrictions, and even some cities have gone back and changed their flavor restriction to include menthol. So doing those flavor bans of banning flavors for all products, certain products, or even some areas have done it in certain types of stores. So these products could only be sold in an adult shop or store, for instance. Then we can talk about other policies like content neutral advertising. There's a good example out of Orangeburg. They actually had a zoning, signage ordinance already in place in the county, and they didn't even know it. And the ordinance said that there could only be a certain amount of advertising on windows and doors of stores. And so there's already a policy in place. All they had to do was enforce it. And so that's where content neutral can come into. This idea of reducing exposure, marketing is one way people get exposed, is you can implement a content neutral policy through like a zoning or signing ordinance that says only a certain percentage of the window or door space of the actual retailer space can be covered in tobacco ads. So you're reducing the percentage that these stores can have that marketing. And then we can think of some other interventions. That's why I say policy and other interventions, because there's always a question of political will and what can be done and what can't be done and all of that. So there's other interventions that can work. Social media campaigning, media campaigns are one of the top interventions in tobacco control and really spreading the message. So social media campaigning is one intervention. I'd also talk about retailer interventions. We have another good example from Charleston County of really working with retailers to see if they can make any voluntary changes themselves. So even just moving an advertisement or moving a product out of sight or things like that, the retailers can actually, especially with your smaller retailers, your more mom and pop shops, bigger retailers that have more corporate interests, maybe a little harder, but you can definitely kind of work with retailers directly and build those relationships and really get them to make some changes, or at least educate them on all of what they're selling, what that does. So just some ideas in policy, but definitely top of the list is local TRL and implementing that. And there's already been some work done, and more work can be done and needs to be done across the country, because it really creates that structure of policy. And then lastly, impact, right? How do you have the greatest impact and all of that? How do you measure success? I think a policy is only as good as it's being enforced, right? So with any policy, TRL or otherwise flavored policy or anything like that, understanding that enforcement piece and making that a key part of the policy and the language is important. And then also coupling policies with cessation. So if there's not a plan in place for cessation or leading people to cessation services, that needs to be included. So I think that's one way to have an impact, is making sure that the policy or policies can be enforced and are enforced, and coupling these policies with other measures like bleeding cessation that can really make it stronger. When you're reducing access, what can people do now? And all of that. So I think that's important. Understanding unintended consequences from the start. So knowing what the consequences are of the policy, what we've seen happen what the impact would be on certain populations is a key part of making sure that you have a strong impact. Collaborating with other organizations that are doing this local work. I know sometimes we can get siloed and do our work, but really collaborating with other organizations to do the work, I think can have a great impact, and working together in that aspect can have a good impact. And then surveying people, right? Understanding before a policy or something gets initiated what people feel about that, and then surveying them after the policy to see what they feel. I think could be a good way of measuring success, and also being comprehensive with policies, right? As been said, menthol has been left out of policies, out of flavored bans. Making sure it's in there, right? When we're talking about tobacco retailer licensing, making sure that the licensing fees are high enough to support the program, making sure that you have all the aspects of the TRL thought about beforehand. And I'll just say that, when we're talking about policy is not the end. It is a success, but the success really comes for what happens after, right? And having that plan for what's going to be done after it's implemented. So that's kind of my soapbox. And remember DPI, and we at Counter Tools are big on data. And so we can, like I said, we're working with some areas to support data collection. So I can definitely talk to anyone more about if you want to get in those efforts or get in the efforts in the future. That's definitely something we can discuss further. We have a really great resource, countertobacco.org. So if you want to learn more about the research and the impacts of what's being done at the point of sale, if you want to see pictures from around the country of what's being sold and marketed, if you want to get some activities, we have some youth engagement activities that you can get to help with that youth engagement work. Countertobacco.org is a really great resource for that. And yeah, I think that covers my spiel, and hope you all learned a little bit more about the point of sale and what all it entails, and some key best practices that you all in your work can implement.
Well, good afternoon. I'm Lori Mosley, and it is my pleasure as a lifelong resident of Lancaster County and a former representative of the Health and Wellness Commission to be here today to speak with you on our efforts to promote a smoke-free and tobacco-free status in Lancaster. But perhaps exhilarating may be a better adjective, because I just got a notice on my watch that my heart rate's over 100, so it's much better, much easier sitting out there than it is sitting up here. And I also want to apologize in the beginning, and don't you hate it when speakers do that? But I was asked to talk about our efforts, and that started back in 2008, and I don't know what I had for supper 2 nights ago. So I will be referring to my notes while I'm discussing this topic with you. And I just want to talk briefly about what the Health and Wellness Commission is. It is a committee that represents the 7 districts of Lancaster County, but there's also representatives from the school district, some businesses, and our local hospital that is part of that. And back in 2008, York County had an ordinance, or had been in the process of some smoke-free issues. And, our chair at that time, Bob Duffelhoffman, he was looking for something for our commission to work on. And so he asked someone from York County to come and talk. So that's where the ball started rolling with us. So if you don't learn anything from me, just remember, pay attention to what your neighbors are doing. We can certainly learn from one another, get encouragement from one another, because if it wasn't for York County, I don't know if we really had done this. In preparing for this, I spoke with Bob and Vicki Henson, another former leader or chair of our commission, and I read over some notes that Karen Nichols and Irene McCarthy have put together. But what Bob said really struck me. He said that at that time in 2008, they expected this to take 2 years. Took 5. So that illustration earlier about pushing a boulder up a hill, yeah, we were just inching it over to the left. It just or the right, whichever way. But it is definitely a struggle. So before we got started, the members of the commission decided to talk to different representatives on the county council to try to get a feel of what they thought. And there was a discussion about how it applied in Lancaster, the smoke-free policy that the city of Rock Hill had passed, and they wanted to kind of brainstorm. So back in July of 2010, that's how long it took for us to brainstorm and talk. Input from DHEC, including specific talking points, focusing on businesses and workplaces, and the detrimental effects of secondhand smoke. We also notified or gathered data about healthcare costs related to smoking diseases. We got petitions and letters of support to garner support. Businesses were approached to see if they would display no smoking signs, which was a big deal in our community. The Health and Wellness Commission worked with the Lancaster County School District to develop a Great American Smokeout essay contest with the students. And then we continued to really poke at our different council representatives to get their input. Then 2 years later, we involved the county attorney to ensure the language of the ordinance was acceptable. In August of 2012, we had our first reading. Then after our second reading in September, we really went to work some more because there was a little pushback in our area. So we had flyers, informative letters to businesses, we had petitions. We did a lot of press and local press about our Smokefree SC contest, letters to the editor, and we just continue to bombard our council with all this support that we had. And we had a phone line for our Health and Wellness Commission, and it was being utilized as a smoke-free support line. So we really even went to our churches. We really went to every group we could think of to get support. Then the third reading happened in 2012, and it passed 4-2. There was disapproval with the ordinance publicly, but there was really no real opposition. There was a few people that were saying they were going to sue, and how could we do this? How could we take away their cigarettes while they're eating? But they were all bark and no bite. That was really it. So I think another thing you can take from me is sometimes folks will say a lot of things, but they won't back it up. So if you have a lot of support, if you have done your homework and you've got the backers, you can do just about anything you want to do. So in 2012, the tobacco-free ordinance had passed, and the county administrator discussed education efforts for our public and our businesses. And we were also recognized by the county council and by the Tobacco-Free Collaborative for our efforts. So we were very appreciative of that. So that was back in 2014. We were tired. That may not sound like a lot, but it was a lot of hard work. And so as a commission, we went to focus on other things because if I didn't say it already, we were tired. We were exhausted. So in 2019, with Irene on board, we decided to pursue a tobacco-free status. We had talked about that a little bit back when it first passed, but we were afraid after we met with some of our council members that if we did a little bit more, it wouldn't pass. So we thought, let's take little baby steps to get to where we need to get. So in 2019, we started with things like the World No Tobacco flyers, e-cigarette brochures, tobacco-free signs, e-cigarette presentations, even did a tobacco survey. letters to the editors about e-cigarettes in our local news. We did more presentations to the county council, and we talked to the different municipalities in our county. We even had a tobacco-free Lancaster video. So we did our best to inform the policymakers on our local level, and we really looked at what was happening on the state and federal policy. We really worked to improve communication with county council, kept them more abreast of what was going on, and DHEC was a big help to us in this process. So in 2019, we had our first reading of our new ordinance. That was added. The smoking will also include the use of an electronic device, so no electronic or battery operated device, and anything that would resemble smoking will be banned. Second reading was in 2019, and then we became smoke-free. And the commission worked with the municipalities in our county, and all of them agreed and became smoke-free. So again, this was a very, very long process. So do not give up. It is worth it, very much so. Thank you.
Thank you for that. I now know some of what to expect moving forward. Hello, my name is LaShondra Morgan. I am the project director of Breathe Easy Tri-County, as well as the health committee chair for the National Council of Negro Women Bethune-Leonard section in Charleston, South Carolina. The Center of Health and Equity, Black Health and Equity, approached me and my coworker at the time, Hyacinthi Mwangu, and I'm like, wow, they really must have done their research, because where did they even get our names from? But they called us and they talked about the health disparities as it pertains to menthol and tobacco in our area, and they were wondering if we thought that it would be worth pursuing. And Cincy and I are both members of the Smokefree Low Country Coalition, and so I'm thinking about all of the data we collected through the point of sale research that we've been doing throughout the years. Some of what they said kind of came to light because we thought about the neighborhoods across the county that we've researched with the marketing practices, marketing behaviors towards youth. And we thought about like the African American neighborhoods in the county. Smokefree Low Country does the point of sale research for Charleston County. And we noticed a lot of predatory marketing in the African American neighborhoods versus when we go to an area like Mount Pleasant. Like, you don't really see menthol or tobacco, like you don't see those ads. Like, they have sign ordinances that they follow, and then we also found that there were ordinances in some of the African American neighborhoods that just weren't enforced. And then part of me went back to my college days. I don't know if any of you have ever watched Chappelle's Show, but there was this one episode when they were doing a parody of what do you call it, a TV show, game show. And he asked, why do African Americans smoke menthol? And the contestant said, I don't know. And he was like, that is correct. And so I kind of thought about that. I'm like, oh, okay, well, now I have my answer. The Center for Black Health and Equity really did a good job on educating us on why African Americans choose menthol. And so if you want to know more about why, a great resource is this mini documentary. It's about 15 minutes, called Black Lives, Black Lungs. And it really, really opened our eyes a lot. So they were looking working with a group that was started by African Americans that had experience when it came to social justice issues and racism. And so naturally, I thought about the National Council of Negro Women, NCNW. And so we brought the idea to them, and the Center for Black Health and Equity educated them about everything, about the health implications, the social justice issues, and they were like, how can we ignore this? Like, why wouldn't we want to work with them? And so they took on the challenge. And so we were tasked with starting a multicultural, multi-ethnic coalition to push the work forward. And that is how Breathe Easy Tri-County was formed. Even though our goal is to get all flavor ban to include menthol passed in the city of Charleston, our community partners that do the work in the Charleston area were like, well, you know, this is a Tri-County issue. Y'all can't just focus on Charleston. Y'all need to focus on Berkeley County and Dorchester County. And so we had all of these people on board that were ready and willing to support us. So as of now, we are working with the African American Tobacco Control Leadership Council, working with American Heart Association, American Cancer Society, American Lung Association. Those are our what we call our TRICARE agencies. And they're providing us with lobbyists like Beth, who does an amazing job. They keep us updated on what's happening at the State House and, you know, kind of give us little tips here and there of different strategies of what we can do. Working with a couple of branches of the NAACP. Of course, Smokefree SC, the Medi Community Resource Center, Smokefree Low Country. We're also working with the National LGBTQ plus Cancer Network. We've partnered with different radio stations in Charleston, like the gospel radio station 106.3 and the old school station 92.1, the A. Philip Randolph Institute Greater Charleston, MUSC, Campaign for Tobacco-Free Kids, and of course, DHEC. And if I forgot anyone, charge it to my head, not my heart. But we have been getting a lot of support. There's a lot of momentum around this issue. So with the policy that we would like to have passed, we are very much about the policy being equitable, meaning that we want it to touch all zip codes, not just some, but all of them. We want licensing, that's a big part of it, and we want the language, we want it to have language that excludes people from being accosted by law enforcement for using menthol. We want them to actually go after the tobacco retailers, the people that are supposed to have the licensing. So when the opposition that we have had from some African Americans is because of the lies that are being pushed by Big Tobacco, that this is another way for us to target African Americans and incarcerate African Americans. That's not true. And we're so much about that not being an issue that we're actually willing to walk away from the table if that is not in the policy. So helping us with that is the Public Health Law Center. They're helping us with that language. And so how we're going about pushing this work, we have 5 different subcommittees. Have the Cessation subcommittee, community mobilization. We have a data subcommittee, education campaign / communications, and a policy subcommittee. But right now, I would like for my people that have been helping us with this effort to stand and be acknowledged. They work really hard. A lot of the people who, y'all give me. So a lot of the people that help us out are community members that are actually doing this work like outside of their 9 to 5. So they're really burning the midnight oil, working on weekends and all that stuff. So I really appreciate all that you all do. So we're kind of building the house as we're working in it, and we're trying to come up with strategies, like ways to weave the subcommittees together to figure out the best way to push this work forward. With the community mobilization subcommittee, they're out in the community trying to help people know who we are. They're pushing our messaging. We're trying to come up with ways to engage legislators. And then they work with the Cessation subcommittee, because a lot of times when we're at these community events, we actually have people that will come to our table and ask us, they're like, help me, how do I quit? Or I have this person who has been smoking for 40 years and we're trying to get them to quit, like what do I do? And so we push them materials from the Quit line and different things like that. With the data subcommittee, we actually are in the process doing our point of sale research, like Jackie talked about. And we're out there compiling data, seeing who's selling or marketing to youth, who's selling flavors still, because a lot of flavors were banned, not to include menthol, but they're still out there selling those flavors. So we'll be able to come up with infographics and let the community know what is actually happening. And then with the education campaign, they're doing a lot. right, they're trying to figure out, like, what is our messaging going to be? How are we going to educate the community? Like, what should we do? So right now, I always like to have my art people at the table. They just have this different way of looking at the world. They're talking about using edutainment. So how we've worked is we use the arts to bring people together, and then we sprinkle them with health information while they're there. It just kind of makes it more palatable for everyone. And so that's what we're working on now. Wheels are still turning, but there's so much momentum that people are stopping us and asking us, well, how can I assist you? People are offering resources, money, because they really believe in what we're doing. And then our policy subcommittee is kind of fighting two fights at once. So yes, we're trying to get the local policy passed in the city of Charleston, but at the same time, we are fighting preemption at the state level, because if preemption passes, then everything we're doing at the local level will be for nothing. So the way that the state, how they're pushing preemption right now at the state level is they're just kind of telling everyone, we just need tobacco standardized across the state. And so some of the politicians are like, yeah, I'll vote for that. That's easy. That's a common sense thing. But when they learn about the health implications that are involved, they're like, why would I vote for that? A lot of them don't know. And so, so we're kind of fighting two battles at once. But everybody that knows me knows that I'm a dreamer. So, of course, we want the Charleston, the flavor ban to pass for Charleston, but at the same time, we really would love for it to have a ripple effect, so that maybe it starts in Charleston, but then the surrounding areas will also do the same thing until we have this thing banned across the state. Thank you.
Hey, that was great, you guys. A lot of information about local policy. Who's got questions?
I'm Kimberly from Laredo. So you talked about content neutral advertising, talking to Miss Jackie. Content neutral advertising, what do you do when, or what is your best advice for when we know that there is a law in place that's not being enforced, and the reason why it's not being enforced is because the big tobacco company is perhaps giving them perks to show that advertisement? Or to put that advertisement in the window, and so it's nothing attractive for them to say, okay, we'll take it down. What do you think about that? What is your advice?
Yeah, I think, there is that piece of the industry saying that, you should have this certain advertising and marketing. And so there is that piece that you have to deal with, those contracts and what the industry is saying. But at the end of the day, if there is a law in place, there is a signage ordinance or zoning ordinance that says that, that can't happen, that amount of advertising can happen, that takes the precedent, and that has to take the precedent. So I think, even with those ties to the industry, the policy still takes the precedent. And so I think you can just kind of go off of that, and irregardless of the industry and big tobacco's influence is really enforcing those policies and making them strong in the first place. And I think also with content neutral advertising, there's also an incentive, because reducing those advertising can help with safety concerns. So when you're talking about law enforcement and all of the things that they have to do in communities, well, if advertisements are blocking the windows and doors and people can't see in and out of these stores, that is a huge safety issue, and that will directly impact other players in the community, like law enforcement and crime and all of the things that are happening in communities. So that's another way to spin it too, is talking about that safety aspect, and even just generally beautification, right? Making our places and our communities, look good and stay good and all of that. So there is that argument too with beautification and making sure that places are match the community and are not littered with tobacco ads. So there's definitely ways to kind of spin it in a certain way to do it. But yeah, if there's something on the book, or if there's not something on the book as far as a signing or zoning ordinance, that would be the way to go.
Thank you. And just a quick follow-up on that. I was thinking about the same thing in regards to it not being safe because maybe law enforcement couldn't see in or what have you. But what if it's not important to them? What if that's like the last thing on their list that they are thinking about doing, is to enforce something like that? Because that's what I've run into, and that's why I'm asking.
Mm-hmm.
What are your thoughts? I know that's a hard one, but what are your thoughts?
There's a lot of priorities going on. It's definitely a hard one. But I think, as we've seen in our work of involving those law enforcement agencies in all aspects of your tobacco control process. And I was on a webinar where a law enforcement officer, he spoke and he talked about the issue at the point of sale and what he was seeing and all of that. So I think that's a way to kind of, yes, it might not be top of that priority, but I think once you can get those connections and get those folks involved in the actual process, we talk about non-traditional partners, traditional partners, whoever you want to call it, involving all aspects, all people, bringing all people to the table, whether it's top of their priority list or whether they're the opposition or whether they're youth, whether they're smokers, bringing all those people to the table and really bringing up that awareness, I think can help fight some of those issues with prioritization and all of that. I think once people start to realize the problem, they can make better decisions and get more on board and all of that. Mm-hmm.
I'm Beth Johnson with American Cancer Society, and I'm with our government relations team. And I can't see who asked that question back there. But I would say for anyone who is, if you have an ordinance on the book already and you're trying to figure out, okay, how do we enforce that ordinance? The very first thing that I would encourage you to do is go to your city administrator, go to your city or your county council and have the conversation with them first, and then allow them to be the decision makers in how you enforce that. And if you don't have law enforcement who says, you know what, we're already overwhelmed, we don't have time to enforce a sign ordinance or whatever it may be, then it's all about finding that right champion and being able to then take that champion with you. So I would not, for you and for your coalition working, I wouldn't say go to that store owner. That would be the very last thing you'd want to do. And first, go to your city council, go to your city administrator, go to the mayor's office. If you need to add a little publicity behind it and a little media that encourage that, I would certainly say that's an easy, sometimes in local papers, an easy thing to say. We're not enforcing this. It's already on the books. We need to do better in enforcement. So we can help with that if anybody has any questions on how to get those people to listen to you.
I was going to say, Phil Clark from Just Say Something. Part of this, we've been participating in Counter Tools for quite a while now and have built a good relationship. And I think at the end of the day, all of this in your local community comes down to relationships. And so what we were able to do with Counter Tools previously, fortunately, Spink's corporate headquarters is in Greenville. One of the Spinks is a former board member of ours. So it's very easy to go into Spink's, take the survey, even pictures, and then go back to the corporate office and say, look, work with us. You know what we do. You support us financially. Let's work together to make this better so our kids aren't marketed to from your stores. And so now I know some of you have Spinks across the state. We have QT moving in or has already moved into the state real strong. They have a district office in Greenville. So when we complete this next round of our Counter Tools, we're going to be making those meetings and having those conversations with the corporate ones. And then I'll rely on a lot of our coalition and board members to go into, if they frequent mom and pop stores, to have those particular conversations with them.
Dave Keeley, York County. I did want to make one echo statement, and that is the champion concept. We've used that in York County. It's very important. And maybe Lancaster County want to comment. When you were in the midst of your conversations, did you have a particular one or two county council members, city council members that really took the burden of explanation from what were small meetings between the commission and those one or two people? They take the burden off the commission by they become the voice with their peers. And so that did that happen with you? Yeah. And one other comment from York County, we did the the ordinance for 100% indoor workplace, no tobacco smoke, And we were fortunate to have the ability to look at acute MI data for York County residents for the 3 years after our ordinance went into effect. And we had a 20% reduction in acute MIs in the 3 years. Now, the cigarette tax went up in 2010, and the 3 years I'm talking about are 2010 to 2013. So that's probably was a factor, but we feel that that degree of decrease. So that's another thing that you can maybe keep in mind, you know, how you're going to evaluate the effect of what your public health policy, and see what opportunities you might have there.
So for the person in the back, will you introduce yourself, please?
I'm Suzette McClellan, and I'm with the DHEC PD region. And this question is for LaShondra and Lori. How do you get and keep people engaged in coalition work around tobacco prevention and around putting policies in place?
Well, again, initially, it's learning from your neighbors and finding out what they're doing, and the interest has to be there in the beginning. You have to have people that are passionate about what they want to do, but to keep the momentum going, you have to just find new avenues of keeping people engaged by keeping your message out there. Don't be the nagging child in the back seat. Don't be forgotten. Keep pushing what you want. And it's a credit to the leadership we had, that we had several years that we started looking at other things. And then back in 2019, we went back working on our new initiative. So part of it is the leadership. The leadership has to be there to keep people engaged.
So with Breathe Easy Tri-County, we use the kids. Kids, people like messaging from children, and so we had these T-shirts made that said "Stay woke, don't smoke," which actually came from one of our interns. So we got those T-shirts made, and people were just, what is this about? And then they'd come up to us and ask us about the shirts. But then the kids, we worked, the Community Mobilization Committee signed up for what was it called, Kids Bash? Yeah. And so there were all these vendors out there, but our table was just about smoking and smoking cessation and the effects. And so the kids kind of guilted their parents into getting more information. We had this little fake lung, and it asked, do you think this lung is from a person that smoked 2 packs a day for 20 years, 1 cigarette a day for 10 years, or someone that never smoked at all? And the answer was someone that never smoked at all, because it was the lung of someone who had been overly exposed to secondhand smoke. And so the kids kind of looked at their parents, and they're like, yeah, I know I need to quit. But they just were, some of them were like really flabbergasted at the harm that they realized that they were causing their child. And then we started talking about vaping, and the parents are very concerned about their teens, tweens, and vaping. So we got some support that way. But using the kids really piqued the community's interest.
Hi, Jim Thrasher, University of South Carolina. My first question is for LaShondra, and then I have one kind of for LaShondra and Jackie. With the FDA announcement around the flavor ban, I'm wondering if you think that might in some ways make your work more difficult, because localities will be thinking, oh, well, the feds are taking care of that, so we don't need to do that at the local level. I'm wondering what you think about that. That's the first part. And then the second part is just anticipating other kinds of resistance to these local initiatives that I think are really important. Do you see flavor bans as really only being effective if you also have TRL? And so you really have to have both of them going for it to be a meaningful initiative in your localities.
So one of our partners is the African American Tobacco Control Leadership Council, AATCLC, and they let us know all the time during our coalition meetings, don't think that this is something that's going to be solved overnight. Yes, the FDA is moving on this, but when are we actually going to see action? Like, when is this actually going to happen? We're not going to sit back and wait. And they sing that all the time. And so we also sing that to our local community members when they ask about that.
Yeah, and I think on your question about TRL and flavor policies, I mean, they can definitely be done separately, but so you can do it either way of including it in a TRL or just by itself. But I think it should be done together. You know, I think the good part about TRL is you get that tracking aspect, so you don't even know what retailers are selling, what type of flavor products they're selling, all of that, until you know who they are and where they are and in what communities they are in. And so I think that TRL really gives you that tracking aspect and that structure so that you can put other things under it, and you have a mechanism for understanding that over time too, with retailers having to get licenses annually and pay that money annually over time. And then with that TRL, you can see the changes that happen. Say if you have a flavored restriction under it, you can see, okay, well, these retailers that have a license and maybe they didn't renew their license, or they lost their license because they did certain things, you can see it'll have an impact on what the results you see from a policy like flavor policy. So when you know the linkage between retailers that have a license and what they're selling, and then you can see how that impacts, how that reduction in retailer density in retailers, or that change in retailers, can impact the changes you see in restricting the flavor policies and the impact of that. So they definitely work hand in hand, and that would be the top recommendation. But they could be done separately if needed. But I think, yeah, definitely TRL top. Mm-hmm.
Anybody else? Raise your hands. Feel free. All right. One more, Dave. Yep.
Yeah, for Lancaster, again, this is basically for the benefit of those who are thinking about this. What kind of pushback did you get on the economic argument? Particularly restaurants and bars, their word was, I'm going to lose business, and it's going to hurt me economically. How did you handle that?
I don't really recall much of a pushback from those businesses. It was more for some of the patrons that go there. But what part of our evidence that we produced was, what does secondhand smoke do to your employees? What is the insurance risk of allowing smoking in your business? Obviously you think about fires, but we also, because that was part of what I did. I was working on my doctoral project, so that was part of the piece that I was brought into for. And, I did some research and found some data on how much productivity was lost due to someone being out because of the exposure with secondhand smoke. So, but I don't really call the businesses. Anybody in the county really think much? I think for me, my recollection was more patrons than the establishment. And there's one anecdote I want to add, and maybe I shouldn't, but I will. As a provider, I also use Epic, and when I'm seeing patients, that's one of the buttons we have to click. Do you smoke or using tobacco products? And when I'm seeing children, the parent might say, yeah, I smoke at home. And I have a habit of looking at the child and say, don't you ever start. Learn from your parent, because they're smart. They're raising you, and they're just burning money. They're doing something they know is hurtful to them. And that tells you how hard it is to stop. And when I say it like that, they're probably thinking really mean things about me. But no one's ever said anything. The parent's like, that's right, don't you do it. And the child's like, no, I'm not gonna. I'm not going to do it. So every opportunity that you can, bring it up, and whatever way you choose to do it, I think is very helpful.
Well, oh, you got more.
Yes, I have a question.
Go for it.
Okay, so you said earlier that you put out feelers to the county council to see how they might feel. What did y'all do?
We just simply had dinner with them. Some of the again, small community. So some of the commission members were neighbors or went to church with some of the council members. So we were very careful to use the ones that knew them on a personal basis. We thought that personal touch would be a big benefit, and it was.